My name is Mai Lam. I would like to congratulate you on your newborn baby. The first 2 weeks after bringing your newborn home is a very special time. It can also be very stressful, especially if you find yourself with more questions than answers. Today, we are going to answer some of those questions and hopefully make the experience a little bit easier for both you and your newborn. First, how often should you feed your newborn? Newborn feed every 2 to 3 hours. Some newborns are sleepier than others are, and they may sleep through their feedings or after a few minutes into it. During this first 2 weeks of life, it is very important to not let them sleep more than 4 hours without feeding to avoid low blood sugar and excessive weight loss. You may keep your baby awake by rubbing the head, playing with their feet, or simply unwrapping them. After the first 2 weeks, they may sleep a little bit more, and it is okay as long as they are gaining weight appropriately. So, breast milk or formula, what is the best choice? Breastfeeding is the best source of nourishment for a newborn baby. It provides immunity for the baby, creates a special bond with the mother, and it is beneficial for the mom's health and well-being. Here at Legacy Southwest, we have an excellent lactation consultant who can help you in a way that you feel comfortable and empowered. Breastfeeding should not be a source of stress for the mom. Formula is a very safe alternative to feed babies. And those are the only two things that newborn can feed, breast milk and formula. There's no need for supplemental water at this time. They cannot get chamomile or honey. How much sleep does my newborn need? The safest way to sleep for your baby is on their back, alone in the crib without anything in the crib. No blankets, no pillows or toys, no ornaments in the crib. The sleep schedule of a newborn can be a little crazy in the first few weeks of life since they are adjusting to the day and night cycle. Patience. This period does go away after a while. So, what's the best way to bathe my newborn? Newborn gets their first bath in the hospital, and you don't need to bathe your newborn until the umbilical cord comes off. And this can be in the first 2 to 3 weeks, sometimes sooner. You might bathe your baby once a day with warm water. Never leave your baby alone on an elevated surface or in the bath water. Let's talk about cord care. So try to keep cord clean, dry, and uncovered. This will make it fall a lot sooner and avoid infection. Do not use alcohol or gentiana violet. Do not apply bandage, cord, belts, or anything to the cord. It will not prevent hernias, and it might cause an infection of the belly button and can be very severe condition for your newborn. When can I safely take my newborn out in public? For the first few weeks of life, especially in the first 2 months, try to avoid crowded areas. In the case of going out, your baby needs to be in a car seat in the back seat of the car. This is recommended actually until the age of 2. Wash your hands often, avoid fixed contacts and people who smoke. Newborns have an immature immune system and may get sick easily. My baby isn't feeling well. Should I take him to the emergency room? If your baby feels warm, you should measure the temperature, and rectal temperature is the best way to check the temperature of a baby. Anything more than 100.4 degrees Fahrenheit, this means your baby has a fever. If you do not feel comfortable checking the rectal temperature, axillary temp is also acceptable. 99.4 degrees Fahrenheit or higher should also be considered fever as well. Fever in a newborn is never normal. It is always a reason to take them immediately to the emergency room for evaluation. Other signs of illness in newborns and reasons to be taken to the emergency room are when they're not feeding well, frequent vomits, no urine diapers in 6 hours, trouble breathing, and change in color or loss of muscle tone. What are some common health issues newborns can have in the days and weeks after they are born? So all newborns have a rise in bilirubin in the first days of life. Bilirubin is the yellow pigment derived from blood. It accumulates in the skin and eyes. Up to half of the newborns may appear jaundice. Nowadays, bilirubin is closely monitored, and in some cases, babies might need special light or phototherapy in case where bilirubin gets to be very high or goes up very rapidly. If your baby looks very yellow or jaundice, please call your pediatrician right away. Newborn can accumulate a lot of secretions and may sound a little bit congested. Use nasal saline drops and bulb suction if this is the case. Some skin rashes are normal in the first 2 weeks of life. Always ask your pediatrician about rashes. Since babies can have many wet diapers and stool diapers a day, it is normal for them to get a diaper rash. Barrier creams like zinc oxide or Vaseline can be applied with every diaper change to avoid getting a diaper rash. Let's talk about bowel movements in newborn. What is normal and what is not. The first day of life, your baby may only void once, and that is okay. By day 3, they should pee at least 4 times and up to 6 times in the first week of life. The poop of the first few days may be black and tarry, and this is called meconium. As days goes by, it might change colors. Newborn may have many stool diapers a day, even after every feeding. This is normal, and the reflex will go away in the next few weeks, especially if they are breastfed. Stools will remain soft, but become less frequent. Normal poops is always soft. Hard stools are never normal. Normal color stools are normally yellow, very soft, and seedy, typically of breastfed babies. Green and pasty if they feed more formula, and brown. Also, abnormal stool colors are white, black, and red. They are always a reason to talk to your pediatrician. We have talked a lot about the newborn's care, so let's move on to the mom's health. In the postpartum period, because of many factors including hormonal changes, emotional lability is very common. This may range from postpartum blue to postpartum depression. Postpartum blues is when the mom feels emotional and sentimental. They can cry easily, especially when the baby cries. However, these moms feel happy. They do not have disturbing thoughts and enjoy their baby. Postpartum depression is characterized by sadness, lack of energy, appetite, and sleep disturbance, inability to enjoy positive experiences, including the new baby, and even having thoughts about hurting herself, the baby, or others. This condition happens to many women, so it should never be a reason for shame or inadequacy. Your OB-GYN or your baby's provider are the best person to talk to about these symptoms as soon as they appear. They will guide you to getting the help needed so nothing bad happens. I hope that you have found this video to be very helpful in your journey with your newborn. If you have any questions or concerns regarding your new baby, reach out to your legacy provider for help. You can call us at 832-548-5000 or visit our website to make an appointment. I'm Mai Lam, and I would like to thank you for watching this video.